Good afternoon. Welcome to the Zest Wellness webinar. Today we are talking about the empowered patient and how to help you be involved in your health and wellness. My name is Karen Kushner, and I'm joined today by Nathan Kolar and Sharon Looney. If you would like to ask us any questions about today's presentation or share suggestions for our next webinar topics, please connect with us. Here are our social media handles and our various online outlets. We have our Zest Wellness blog, our webinar, and also our podcast. Something we want to make you aware of is our 12 Days of Zest promotion, which will be starting next month in the lead up to Christmas. It'll be our daily tips to help you have a healthy and relaxed holiday season. So stay tuned on our Instagram and Facebook for that promotion. And with that, we will go ahead and get started.
Awesome, Karen. So thank you for that introduction. For everyone listening, before we go into the agenda for the webinar, we're first going to explain from a high level what is an empowered patient. First and foremost, what is an empowered patient all about? So right now, put all your focus into kind of answering these questions. Do these questions on the slide, do they sound like you? The reason we're asking these questions is because to understand something as complex as our health, we need to ask questions. We can't necessarily assume, make these assumptions. We really have to start asking these questions and putting effort and confidence into who we're dealing with as far as our healthcare professionals. What we really like about this webinar is that we'll share some practical tools with you. We have two really cool worksheets that are in the handouts section of this webinar. You can download them. They're in PDF form. We'll be sharing those sheets with you. And we do this because overall, we're really trying to create a partnership with our healthcare providers. So by becoming an empowered patient, we're creating a partnership. And when we're dealing with physicians and medical professionals, it's not a matter of us becoming empowered, doing our research to present challenges or to be frustrated towards our medical professionals, but rather we're just trying to leverage a doctor's expertise. For everyone listening, really, this quote really sums things up nicely. It's not about X, it's about what do you think about X. So really kind of keep that in mind as we go through this webinar. It's not about X, but rather what do we think about X. And so we can see that the reason why this is important in the first place is because patients who really understand their condition and their discharges and their action steps are upwards of 30% less likely to be readmitted to the hospital. So some very powerful statistics. Of course, I know for myself, it's really easy to think, okay, I can't ask questions what my doctor might think I'm asking too much or I'm too nosy, but we really have to be assertive, not rude, but assertive, and know that our health does come first, our popularity second. So once again, it's a matter of being assertive and respectful, not rude. So keep that in mind as we now present our agenda to you.
So today we have two main focuses. One, choosing your ideal physician, and two, coming prepared to your doctor's visit. We put these sections together to help you feel empowered and feel like an informed consumer of your healthcare. And along with these topics, we will also present how Colonial and Zest Wellness are able to support you as you become an empowered patient.
Fantastic. Now, our first topic, choosing your ideal physician. Think about it. Your ideal doctor, do they make you feel comfortable? What about the amount of time you spend with them? Do they even allow you to ask, they allow you time to ask questions, and also in a manner that you understand? A lot of individuals will say your health depends on your ability to comprehend what your doctor is telling you. And like we mentioned in our summary slides a few slides ago, we're really trying to turn our relationship with our physician into a partnership. So we're really trying to be assertive and make sure we're kind of pulling our own weight and making a partnership with the physician, making sure we're taking the time to ask questions and coming from a place of curiosity. Now, for our other presenter in this, we have Nurse Sharon Looney. Sharon, in your experience, when we are with a physician and we're trying to understand our health and really trying to understand maybe our diagnosis or what type of action items in terms of possible medications, what do you think are some common ideal questions we can ask a physician to make sure we really understand our condition? From your experience, what are these ideal questions?
Okay. Hey, everybody. Thanks, Nathan, for the question. So when we go to our doctors, I would always be prepared and think of your questions in advance. So when you're picking your ideal doctor, you want to think about what times they're open. Do they do it on call? What kind of style they have, like whether they do surgery. So what is the scope of their practice as well? And maybe what's their specialist interests. I know a lot of family practice doctors also have a special interest. So I think that is really good to know. They might have a special interest in nutrition, or they might have a special interest in pediatrics. And by understanding their kind of special interests, you might be able to gain more from them as a client.
Fantastic, Sharon. And of course, Sharon, you come from, you have this awesome experience in very much a surgical setting.
Yeah,
Even
for sure.
after, if someone has a surgery, or for anyone listening, they have loved ones who've had a recent surgery or medical procedure. What about even just some specific questions about that? If I just had a surgery, what should I really make sure of that I understand in order to
Okay.
make sure I really have a safe and awesome long-term discharge from the hospital?
Okay, cool. So you're looking at your post-op care plan then. So things to ask are when is my next follow-up? So you're leaving. You've been given instructions on how to care for your wound, and what to do in an emergency, what you're going to expect in terms of pain relief, medication. But what you want to know is what are the parameters that I should come back to you sooner, and when is my next follow-up appointment? So you want to know what's normal for your recovery. And then when they give you those parameters, as for example, they might say, expect a little bit of swelling, but if you have excessive pain, then come back to me. Or if you experience bleeding, come back to me. Again, there's so many different types of surgery. It could be orthopedic surgery, X, Y, and Z. And then you'd also want to know which other allied healthcare professionals do you need to contact? And for example, they might have already connected you with a physio, but they might prescribe that you do get physio treatment if you haven't made contact with that person. And again, I'm speaking for orthopedics. That generally ties in with physio, that you'd have to do physio post-op. So that is another example. There's so many different types of surgeries, but in general, know what are the next steps. What are the danger things to look out for? What are the signs and symptoms for when to come back sooner? Because usually you would have a follow-up post-surgery, but you want to know, should I come back sooner, and what are the things that I should look out for? I would say that you should have a clear agenda on that.
That's fantastic, Sharon. And moving on with our topic of essentially finding Dr. Right, we have a number of suggestions on how someone can go about this, whether it be for screening their doctor and seeing, does this doctor have access to specialists? How does this doctor first handle a small problem? Are they rushing me during my appointment? Do I have time to ask questions? Um, what about the office location? If it's a faraway office location, maybe that might be harder to balance weekday appointments that are during working hours. Sharon also
For sure, I
mentioned,
think that one's good, yeah. And like,
yeah,
especially you might want to think, you know, where are you working? Maybe you want to pick a physician close to where you work if you have a very long commute. I know that doesn't happen a lot in islands, but you might prefer it near where you live as opposed to where you work. So think those things into consideration as well in terms of
of course, Sharon,
location.
and even to zone in on another point on this slide, because you
Hmm.
mentioned the power of leveraging specialists. For
Yeah.
everyone's listening who they're trying to see, okay, they might have a range of different medical conditions. They might know friends or family that have a range of medical conditions. And you mentioned one example of a specialist being a physiotherapist, but what other types of specialists are out there? Is it what other individuals besides physio can someone kind of keep in mind when they're meeting with a general physician to say, hey, do you have access to blank specialists? So just more examples of specialists if you can provide, that'd be great for everyone.
Yeah, for sure. I know that in some practices, they have the facility of having a dietitian. I think that is, a great resource. Um, but it would be common that your doctors would refer you on to a specialist. So that's usually how it works. That if you come with a problem that requires a specialist intervention, you would get referred on to someone, and they might have a different location, for example. So if we're talking about our general practice, most of them are, again, general, but they would refer on to a specialist. Some clinics do have other healthcare providers, so they might be attached to a pharmacy and they might be associated with a pharmacist there. So they might go back and forth and they could say, oh, go next door and speak to the pharmacist about your drug dosage. Or they might say, they might connect you directly with their in-house dietitian again, for example. I don't know many general practitioners that have physios on site, but they usually have a list of recommended physios that they would connect to and usually refer to.
Fantastic. And keeping in line also with that theme of essentially what we refer to as a healthcare team, what we're getting at
Yeah.
is it's all about just always doing the due diligence to always have that availability for a second opinion, to not put all of our eggs in one basket, but to make sure that our physicians, they might have specialists that we can see another detailed second opinion. At the same time, and we'll get your comments on this as well, Sharon, is that it's a balance. We don't want to go down the rabbit hole and be having a whole network of different physicians. And so it's really a balancing act of not boiling the ocean too soon. But we also want to
Correct.
make sure that when we're given action steps that we really understand something. So a question for you, Sharon, is that we know that even when it comes to prescription plans, even spelling can count, right? And if you can elaborate to everyone, because this could be a very common situation that come up, how different
Hmm.
hyperglycemia is from hypoglycemia. So very similar spelling, but two completely different meaning words. So for everyone just to zone in on this example, if someone says hyperglycemic or hypoglycemic, can you explain to everyone just how much of a difference those two words mean?
Yeah, they're complete opposite, Nathan. And just for the sake of one little letter, if you misheard it or you were writing it down and misspelt it, you could have a different perception of what your results mean or what your diagnosis was saying. So I'm obviously Nathan mentioned hyper and hypoglycemia. That's related to the condition diabetes, as many of you may know, and there's two different types. But hyperglycemia is when your blood sugar is too high, which can run into a very serious complications. Similarly, with hypoglycemia, is when your blood sugar is actually too low. So again, totally different results. One's too high, one's too low. In general, the treatment options would be different, and each individual would have. I know our co-presenter Karen would speak from experience on this because I know that she does have diabetes. So yeah, there's different interventions that your physician would advise. Be it when it's hyper, you might be on insulin or you might be taking regular medication, or when it's hypo, you might be advised to take supplement glucose. in the form of tablets. But again, they would require different treatment action plans, and you would need to understand as a patient what to do if it's high or low. So I think when we're hearing kind of terms like that can be confusing, we want our physicians and our healthcare team to explain it. Do you know what does that mean? Oh, you're saying it's high? Okay, that's hyper. You don't have to remember these big long words. You just need to know it's high, I do X, Y, Z. It's low, I do X, Y, Z. And so you don't have to be stressed to think, oh, I need to remember all these complicated medical terms. But what your physician and your healthcare provider will do will be explain it in terms that you can understand.
Yes, because we know just how much of importance it is to not go to the physician's office for fun, but to really go there to get action steps that we can seriously take advantage of, and understanding that is, of course, in our best interest.
Cool. I hope I'm answering your questions well, Nate.
Of course, Sharon, that was fantastic.
Can people comment in? I see that we've got some nice attendees, but I'm sure is there a way that they can also ask questions? That'd be great.
Yeah, so what we're going to do is towards the end of the webinar, we're going to open the opportunity to ask questions at the end. Yep.
Oh, awesome. Cool.
Yeah, absolutely, Sharon. I think that explanation was really helpful, especially with understanding your condition in a way that that you can explain yourself. I think is always really helpful. Yeah. So
cool.
Not exactly using the medical terms, but terms that you can relate to in life. And then your doctor, deals with many patients, so they should know how to kind of interpret. Even if you don't use the medical terminology, they will be able to interpret your explanation. So it works both ways. So this quote here, there's a big difference between getting a prescription and understanding your health status. So this really speaks to what Nathan has been emphasizing on the importance of asking questions, and what Sharon said there as well. Understanding the terms that are related to your medical condition, and being able to discuss that with your doctor in a way that makes sense to you. Really, we just want to help you ask the right questions so that you can get a full picture of your health and know how to be an active participant in your healthcare plan. So in helping you to find the right doctor, we know you always have many options in choosing your doctor, and we want to help you be an informed consumer. The doctor who works great for your mom or your brother might not relate to you in a way that you feel comfortable. So we want to help you first and foremost find a doctor that works for you. When we mentioned the questions about their office location, their hours, those things are all really important. So we wanted to direct you to our Colonial Health FAQ page. So for all of our Premier Health policyholders, Colonial, Britt K, and Atlantic Medical, we have a list here of our FAQ pages by location, and these will help you answer questions about finding in-network healthcare providers, and as well as questions you might have about coverage or emergency care. So we urge you to visit that FAQ page if you have any questions.
Now, when we're doing our own research so that we have a sufficient amount of questions, and we kind of ask detailed questions to those who are helping us, we know that it's a balancing act. We know there are pros. Research tells us that 60% of individuals, when they found information online, it did affect a decision about their health. And in addition to that, upwards of 53% said that, okay, yes, it did help with a second opinion. What's most kind of interesting, and for a comment for everyone to think of who's listening to this webinar right now, is that we also found this statistic that 38% claim that from what they've learned online changes the way they cope with a condition or how they manage their pain. And when you really think about it, it's an interesting concept because when we are able to do our research, in a sense, we're bringing in our locus of control. We're establishing some sort of confidence over, okay, I need to take a stance in my own body and I need to do my own research. So what if that confidence in and of itself can be a way to help someone, like what's found here, manage their pain? Because what if a lot of this has to do with the mental side of things? So if we can do our own research and know that we're pulling our own weight, so to say, that could be very helpful because we know that disempowerment can be in itself a stressor. So just imagine when you walk into a medical professional to their office and they tell you something about your condition. So you walked in, with the thing being wrong being your condition, and you walked out with the thing being wrong, not only your condition, but now what to do about it. Now you're even more confused when you walked out, and so that can in itself be a stressor. If anyone also has a pen and paper right now, you can write down this acronym. It's a really kind of comical acronym, and that's GBG. That's GBG, which stands for Going Beyond Google. Because look at this internet research and how do we actually go about it, you can see that we have to be very, very vigilant when it comes to our own research. So if you're thinking to yourself, okay, after listening to the Zest Wellness team, I am going to take a stance. I am going to look into this myself. How we can actually go about this research is, first of all, looking at the URLs of websites. We want to make sure we're really looking at reliable websites. Websites that end with .gov or .edu represent reliable websites that we can accept their health information from. We also want to be very vigilant that if we're on a website and there's a number of different ads for products and it seems like the website is trying to sell us a product, we want to be very, very hesitant with that because that is not something that cannot necessarily be approved by medical professionals or by medical associations. And of course, we know that if you start going on this thing we call the internet, you could be on it for days and years. So really make sure when you're going down this road, you have a specific question you're trying to answer and stick with that. That question almost acts as your North Star, and you're trying to follow that, because if you're reading stuff online, you're going between different web pages, it can become very easily you can become very easily distracted or look at other medical conditions and once again become even more confused than when you originally were. And what we're trying to do with all this is just gather some information and just present it to our doctor in a non-threatening way. We're just doing, which was emphasized, our due diligence to say that, okay, we've done our research and we are just trying to take a stance in our health and control of our health. Here, we're going to present this to our doctor, not to change their way of thinking or anything, but as was mentioned earlier in the webinar, we're really trying to come at it from this perspective. I think it's X, but rather, it's not, I think it's X, but rather, what do you think about X? So we're trying to present options to our doctor, not tell our doctor what the decision is. Some examples of some fantastic, reliable websites that are run by the National Library of Medicine include the links right here. You can see that these are websites that very much leverage evidence-based scientific research so that we can make reliable decisions when it comes to understanding our health condition. And now Sharon will talk to us about our pain management.
So, back again. Yeah, what I want to talk about is, again, within the context of when you're going to your doctor and you've got pain, I'm going to describe just the different types of pain. So there's two main types of pain. There's acute and chronic. Acute is the short-term pain. It's the stabbing pain that comes on in your stomach if you have a stomach bug, and you wouldn't expect that pain to last long-term. So it's considered short-term pain. Usually it's quite intense. So that'd be the description of acute pain. And then chronic pain would be something that's ongoing. So some people might have chronic back pain or chronic chest tightness, and they might feel a lot of discomfort if they had a lung disorder. And so there's two different types of pain, as I said. And what we want to do is that when you're going to the doctor, that you can best describe that type of pain in a way that maybe you could log your pain and share it with your doctor. Sometimes when we go to the doctor, we might say, oh, I've been having pain, and they might say, since when, and how bad is that pain, and how tolerable that is. So having a pain score helps you almost quantify what you've been experienced. And what I want to highlight is that pain is extremely individual. So my pain versus your pain, what I experience is as pain might be no pain to you, or what I might experience to as moderate pain might be extreme pain to you, or the worst pain ever. So the pain score that you see in front of you, it starts at 0, which is no pain, nothing at all, and 10 is the worst possible pain you've ever experienced. So it's just completely unbearable. And in the middle would be 5. It would be moderate pain. So reflecting on your pain and where that is on the scale, and defining that for yourself will help you and your doctor and your physician plan your health care interventions, and it will help plan your medication management as well, and investigating your symptoms. So the more details and the more description you have, they'll obviously ask probing questions like the location, the duration, and this helps define the intensity. So having a number for the intensity will really help you. And don't be afraid to be honest. So for example, if you're given medication, you might be a pain score of 8, it's really, really bad. But it will help you to see, okay, actually, I feel a bit better. I'm going to give that a 7. And then the next day, you know what, I feel a bit better. I feel a 6. So then you can see how your pain is progressing, how it's improving, or it might be getting worse. Hopefully not, but that can happen too. So be honest. Don't be afraid to say my pain is getting worse, because there's things that the doctor, physician, or healthcare team can do. They can change the drug dose, the type of drug, the route of the drug, which is how we take the drug. So it could be orally, could be injection, could be a patch. And we could also look into different ways and alternative ways to manage our pain. So it could be hot or cold compression. We could be looking at mindfulness and relaxation. So we want to help you guys get in the best health status possible by giving you the resources. The aim would be to be pain-free, but for some people, for example, with chronic back pain, it might just be able to cope or tolerate with that level of ongoing pain. For some individuals, they might have a condition where removing the pain completely is impossible. So we would, as physicians and healthcare providers and nurses, we would want to be able to get you to a stage where you can tolerate that. So yeah, having the score will really, really help you and your team manage your treatment. Great. So the next slide we have here is about self-medicating. So I've mentioned that about pain management, and medication is usually part of that, especially pain medication, as we call it. But what is self-medicating, and what does it mean? So essentially, it's not sticking to the prescribed dose and taking medication outside of the doctor's orders, as it were, the old-fashioned statement. So you might decide to suddenly stop taking your medication, or you might change the dosage. You might start taking medication without a prescription. For example, if your friend has really strong pain meds that they use for their back pain, and you're saying, oh, I don't want to go to a doctor, I'll just use what you had. That would be considered self-medicating. So you're taking medication, someone else's prescription, which we strongly do not advise, and you're taking it yourself without the advice or without a prescription of a physician. So this can actually be extremely dangerous. Another thing is that we can self-medicate with alcohol or recreational drugs to manage our health issues. So we're taking substances, so it's considered substance misuse, so we're not using it as we should to maybe manage our pain or manage our symptoms of depression or anxiety with off-prescription things. One thing I want to highlight is I really want to stress the importance of completing prescriptions and taking medication as prescribed, because not doing so can actually be extremely harmful, not only to yourself, but actually to the wider community. Something that has come across in the healthcare system is MRSA, or MRSA. So it's methicillin-resistant Staphylococcus. It's my favorite thing to say out loud. But what it means is that people are getting resistant to antibiotics. And the reason they're becoming resistant is because people have stopped taking their antibiotics for the full course, or through the overprescription of antibiotics, or taking them when we shouldn't take them. So for example, you might feel like, oh, I've got a very chesty cough, I'm just going to take these antibiotics I have left over. That would be considered self-medicating if they weren't prescribed for that specific illness. So you're building up an immunity. The bug creates resistance. It allows bacteria to grow. So it kind of gets to know its enemy, which is the antibiotic, and it mutates and it fights back. So that's how it creates resistance. So we don't want to do that, and we don't want to increase the spread of superbugs. And we want to stay compliant and never DIY with your treatment or with drugs. It's extremely dangerous. So we would like you to seek clarification. You might have read something online which might make you feel a bit nervous about taking this new drug and you're not sure about it, but raise your concerns and speak to your doctor. It will definitely help you and keep you out of harm's way. Another subnote is to mention that some herbal medications, which isn't self-medicating, but combining additional medications, might actually interact with your current medication. So always clarify with your doctor what's safe to use. Just a little bit more on drugs and medication. So when you're at your physician appointment, I would highly recommend that if you're given something new, or if you're on a current medication and you're like, what is this for? And I've been getting this rash, and is it from this medication? Always discuss the side effects. The side effects would be a big thing to discuss with your doctor if you're put on something new. So an example would be, should I expect a rash? Is the rash normal? My blood pressure feels high. Is that down to my medication? I feel faint or dizzy, etc. Or so you've been diagnosed with a new condition and you've been prescribed medication, but you found something else online, or your friend is using something else, and you know what, I want to use what my friend is using. Don't just take what your friend is using. Ask your doctor first. Taking self-medicating or taking other medication might have contraindications. It might affect maybe other conditions that you may have. So we would really say that would not be advisable. And everyone is different. Never share your medication. I know some people do that, but unfortunately, although you're trying to be generous and helpful, like, oh, this worked great for me, it could actually be extremely harmful for someone. So for example, oh, take aspirin, and the other person might be on anticoagulants, which is a drug to thin out your blood anyway. Adding aspirin to it could be harmful and cause a bleed and risk your friend's health. So never share drugs or medication unless you're a healthcare professional and it's been prescribed and safe to do so. So I again, just to reiterate, just always consult with your physician. Never start, stop, alter or change your medication without consulting your doctor. Take them as prescribed. And if you're not sure how it's prescribed, always ask your pharmacist. So when you go and collect your drugs, the pharmacist, they're amazing resources. I think they're so underpraised in the healthcare community. I really rely on them as a nurse when I was in hospitals, and they're absolutely fantastic resource, and they answer amazing questions about your drugs. So they're very, very informative. And yeah, like so. And then the last thing I have here is how long will it take to see a benefit for the medication? As mentioned, what are the potential side effects? So sometimes we might be prescribed a new medication and we go home and we take it for one day and we're like, hey, we're not feeling better. I'm just going to stop taking this. It might be normal not to feel better for a week or 2 weeks if you start a new drug, but understand how your medication is supposed to work. Is it immediate effect? Is it going to work in 20 minutes, 5 minutes, 10 minutes? Which is unusual, but usually that's when you're in hospital. But what you want to know is how long do you expect to see an improvement in your symptoms, and to know the potential side effects to look out for. And before you leave your doctor's clinic, you can see if XY, let me know what I need to look out for, and you will have a list. If X, Y, or Z happens, come back for a follow-up visit if they're not normal. And if there's anything extremely dangerous that could happen with these medications, then know when to go to A&E with them.
Thank you, Sharon. So the second item on our agenda was all about coming prepared to our doctor's visit. So on the next couple slides, what we have is a real strategic appointment game plan. This is all about what's called planned patienthood. So kind of a really interesting spin on becoming an empowered patient. What you'll see is we have this really cool process we'll go through right here. And this one will also mention the PDF resources that are available for download from this webinar. You'll see the first resource is the Tell Your Story worksheet. And as well, we will post these resources to our social media, and so individuals can download the PDFs from our social media as well. So the first step on our appointment game plan is all about our story. So the reason we're doing this is because we all know doctors are not mind readers. So we need to be honest and open about disclosing all of our signs and symptoms, especially because Sharon was mentioning there could be contraindications we really have to watch out for. So we're not making assumptions. We're putting everything out there for our doctor and physician because they are not mind readers. So what the Tell Your Story worksheet does is it really helps us organize our thoughts and our history. We want to be able to log all of our diagnoses from the past and also include things like our family history. It's really important that even if we've done different body composition tests somewhere, or if we've done MRIs or CT scans, we're even bringing in the physical copies or the digital copies of these scans or of these photos, because any information our physician may be able to leverage and therefore maximize our treatment options. So what we're doing with the first step of the appointment game plan is really clarifying our story for our doctor, because in order for our doctor to treat us, we need to input the proper information to them. The second step in our appointment game plan is all about questions. So we started this webinar by explaining that it is vital for everyone to ask questions and to be assertive with their health. So the next step being is, okay, Zest Wellness team, what are some actual questions I can pose to a doctor? And so you can see that that's exactly what the first bullet point does right here. So first and foremost, a respectful sense, we're saying, I have some questions or concerns I would want to run by you. Can I take a couple minutes and tell you about them? So like I said, we're really coming up from a place of curiosity and respect, and that is our intention. So the only thing we can control is our intention. Our intention is to simply ask this because we're trying to take control of our health and we just want to be empowered. When we're doing tests, we also want to keep in mind is the ability for candid questions. So asking doctors directly for their thoughts. So when we're having a test, asking them, what do you see right now? What is that sound, perhaps? These are all other forms of questions that we can directly ask. Our questions don't have to be thought out, and we don't have to laminate our questions in a perfect photo form. We don't have to make sure our questions sparkle. You can just ask direct questions, and the point will be taken. At the same time, we know doctors are human beings, and we want to make sure people feel like human beings, not human doings. And so if a doctor does seem like they're rushed, what if we try to give the expression that we are a cooperative patient, and we're saying things like, it seems like you're having a busy day. Can I take a couple minutes to run some questions by you? Like I said, we're going from human doings to human beings. We're allowing a doctor to feel very approachable with us. That way a doctor can be candid and not have to worry about offending us either. Because we're there for our health, we're not there for our likability. Now, when it comes to even exploring other options, because we want to make sure that whatever option we choose, that it's 100% the correct option, is this. Doctor, what else could this be? This single question and maximizing our exploring of our different options could save someone's life. We want to know why a doctor chose a particular diagnosis, because in terms of understanding our diagnosis, knowing that why can really help. Our last step in the appointment game plan is ensuring clarity. It's summarizing what we've learned and what we need to know we must take advantage of. This brings up our second worksheet that is available for download, and that's the Get It Done worksheet. The D stands for diagnosis. The U stands for understand the plan to help you get better. N represents next steps. We want to make sure we're clear on the diagnosis. We understand the plan to get us better. What are the prescriptions? Are there other instructions we need to take advantage of? And what are our next steps? How long do we need to wait? When do we need to do something? What is our overall timing like? So by using our Tell Your Story worksheet and our Get It Done worksheet, we're just trying to help everyone organize their thoughts and use these as a memory tool to remember our appointment game plan. You can see here we have a full summary of our appointment game plan. Feel free to take a picture of this slide if you have your phone nearby, because this appointment game plan is what we can do to become an empowered patient. We know an empowered patient is important, and how do we come prepared to our office, to our doctor's office, so that we are an empowered patient? The answer to that is by following something like the appointment game plan. We're just trying to make sure that when we walk into that room, we are prepared. We've done our due diligence. We come from a place of curiosity and respect, and we have these questions we can ask.
Great. So I just want to say thanks, Nathan. That was really good. I think those worksheets will be so useful to people. I know even myself, when I'm a patient, I write everything down, because if I'm feeling sick or worried, I think it really does help to clarify your thoughts and get your story and get it done. So well done, Nate, for sharing that. This next slide is about staying informed and health in your community. So recently, there was a Cayman Islands healthcare conference that was open to the public and healthcare professionals as well as patients. So I'd really like to say well done to all involved with that. It was absolutely excellent. What I want to share with you guys is sometimes, even if you can't attend those health events, I'd highly recommend that you do keep an ear to the ground on what's happening in your community. A lot of these things are available online afterwards, similar to this webinar. And for example, there was a really, really cool talk. All of them were amazing, but one that stood out to me that kind of ties in with what to do and what not to do was a critical care specialist from Baptist Health. He described when to go to the emergency room. So I highly recommend that one. Again, the links they'll be hyperlinked and they'll be available afterwards. So yeah, staying informed of health in your community can really help you stay abreast of what's new. There might be a new facility open or a new treatment center, and it will really help you stay empowered and keep abreast of what's new in your healthcare system where you live. So I'd highly recommend it.
Thanks, Sharon. And next, as we mentioned earlier, I'd like to take a few moments to tie in our Zest Wellness program and how it's designed to help you become an empowered patient. So here with the annual physical, we know that going for your annual physical isn't the most convenient thing to do, but it is so vital. So we want to reward you for taking care of yourself, and how you can be sure to get your bonus points for going to your physical is to log it in your Zest Wellness account. So here we have directions of how you can log your annual physical in your Virgin Pulse app. So you can go to the programs page and then click annual physical and enter your information, and then you'll be rewarded the following month. It's just our way of thanking you for taking the time to take care of yourself. The next thing we have is our healthy habit tracking. So when you're at your appointment, your doctor might recommend that you make a couple of lifestyle changes, such as walking, getting more physical activity, or maybe focusing on stress management. So we pride ourselves on our holistic wellness program that focuses on 9 different well-being pillars and dozens of different healthy habit trackers. So no matter what the change is, we have a healthy habit for that. So in your account, you can select the habits that you want to work on, and you'll be reminded every day to take a moment to work on that habit. And you can earn up to 30 points per day with bonuses for tracking multiple days per month. So that'll help you stay on track with those lifestyle changes that your doctor recommends. And finally, the health station. If you have access to a health station at your workplace, we urge you to visit it regularly every month. So not only can you earn a minimum of 250 points per month for using the health station, it really helps you get a basic understanding of your health. So you can take your weight and blood pressure measurements, or weight and or blood pressure, and you can track over time in your account and even earn more for improving your measurements. So that makes it kind of fun to take care of your health. So those are just some of the different program offerings within the Zest Wellness program. And now I will pass it back to Nathan.
Thanks, Karen. So one of the sparks for us choosing to do this topic for our third webinar is that we had a phenomenal member of our team, Katie, in Bermuda, and she pointed out this article that was written by Simone Barton from CORE. And so what we're really trying to do with this, we read this article, we do this webinars, we're trying to tie in Zest and leverage our community resources because we all are one team and we're all one partnership essentially with our health. It takes a village to change someone's health, doesn't it? So you can see that Zest is really tying nicely into the community and the movement of all of us to become empowered patients. We are the CEOs of our own body, aren't we? And so we're being proactive and really coming from a place of curiosity and respect by being empowered patients. And so what we'll do right now is we are going to open this webinar up for questions. We have 10 minutes left in the original time slot for this webinar. And so if anyone has any questions, feel free to type them into the chat box below, and we will answer your questions for you. While we wait for some questions to come in, I'm gonna be selfish and ask Sharon a question because
absolutely, okay.
because
Thanks
Sharon,
for all the questions, Nathan.
But
no
Sharon,
pressure.
you mentioned something that I think maybe when you said this, maybe you really caught some individuals' attention, because it's always nice to hear some real world experience. And so earlier on the slides around the area of you talking about self-medicating and whatnot, you mentioned this whole idea about, for a specific example of medications, you mentioned that if someone is taking a certain drug and then they take aspirin, how that's a practical example of a contraindication. What are some
Yeah.
other kind of contraindications as far as some prescriptions or some specific type of pharmaceuticals that are out there? What should people really watch out for that are common mistakes uh, others make in terms of maybe the right word is mixing their pharmaceuticals?
Yeah, again, the common mistakes is not following your prescription and your prescribed course of medication and when to take it and how to take it. You mentioned like mixing drugs. There's some herbal ones I know. St. John's wort has interaction, which St. John's wort is a herbal remedy that some people use for depression, but it can have interferences with some medication. It's known. So yeah, like it's so important, and I really do stress that although you might think something is not harmful and it might be herbal or homeopathic, it can still have a contraindication for your A condition or B other medications that you're taking, so it might clash with them. Another example would be arnica. And I can give a personal example I'm happy to share, but when I was pregnant, arnica is a homeopathic remedy for inflammation and swelling. And I heard from a friend that they're using it in Germany. And again, of course, I go down the rabbit hole because I'm human too, and I go online and I research it. But what I didn't do was I didn't just take it based on that. I went to my gynecologist and my specialist and my doctor, and I broached it to them. I said, look, I've heard about this new thing. Is it safe to take? Everything online said it was good to take. However, for my specific condition, it was actually dangerous with what was going on with my health. So your doctor knows your whole story and knows the plan, and they explained amazingly why I shouldn't take it because it could cause complications, not with myself, but actually with my baby. So it was a major eye opener, and I'm glad I felt empowered to A, do my own research, and B, bring that research to my physician. So, so important to raise that because even if what we read online might say it's okay, we don't know for sure, and that's even despite being a nurse, what it could interfere with other drugs that we take. So yeah, I highly recommend just feeling confident in bringing up those questions. Another thing to say is that if you weren't confident about asking those questions, bring an advocate. So bring someone with you to your doctor's appointment that might feel like, hey, look, they will be your voice for you and be your advocate and help support your appointment with your doctor. So always be honest and open and give feedback. And I would say active communication is really key. As much as it's great to ask questions, we brought up a lot of questions in this seminar, but also active listening. So it's really important to be an active listener versus a passive listener. So engage in your consults and maybe make notes. And sometimes when we're at the doctor's, we're actually feeling quite unwell. So again, when we're sick, we mightn't even feel empowered, and mentally we might be drained because we're feeling so unwell. So in that situation, bringing an advocate or someone that we know and trust and we feel comfortable with, yeah, can really help us during our consults as well.
Awesome.
Yeah,
Yeah.
I see we've a few more minutes, no more questions. Yeah, no, if any of the audience or listeners have any specific questions, again, there's a text box, so be sure and be free to ask them. I have another couple of things that came to mind. You know, we're looking out and we're trying to see what our doctors should do and maybe what we can do. Another few things to add to that would be to, if you have an appointment, make sure you attend them, be punctual and be respectful of your time as well as your physician or healthcare provider's time. So by running late and, you know, usually there's a form or you have to check in if it's your first time going somewhere. So be punctual, give yourself some time so that you don't feel rushed and your doctor or physician or healthcare provider doesn't feel rushed either. So it just allows you both the time and the environment to have a very productive consultation. And doctors and nurses and healthcare providers, they all want you to be confident in your care. So what we've gone through today is we wanted you to know your resources, being informed of your normal, instead of having your blood pressure taken, maybe just document and ask what it is. Do you know you're normal? If you're worried about finances, Karen mentioned our insurance portal and our FAQ. So just reach out, contact us. We can help navigate your benefits. We've got an amazing customer service team. So thanks to them, they'll help you reassure and keep you informed regarding your insurance coverage. And if your organization has Zest Wellness, please attend the events. If there's a Zest Wellness screenings, which I'm heavily involved in, and please do attend. I'd highly encourage it, because sometimes we can share that information with our physicians if applicable. And Karen has highlighted how to take charge of our lifestyle as well, using the resources like the Zest Wellness program, the app, the blog, which is amazing, will hopefully help you stay motivated and keep you on track. So yeah, communication is key. Think collaborative. Think beyond just our doctors. There's also pharmacists, psychologists, physios, dentists, nurses, and other allied healthcare professionals. And we all want to work together for what will work for you. Again, it's your health. And hopefully we can all together be better.
Thanks, Sharon. I just saw a last minute question come in here, and this will be our after this question we'll conclude. It says, hey, Karen, when you were talking about healthy habit tracking, is that something I need a device for? So Karen, do you mind commenting on that?
Yeah, so I think they mean a smart device or a smartphone, actually, there are a couple of options. So no, is the short answer. You do not need a device. You can track online through your Zest Wellness account. When you log in, the healthy habit trackers are available right on the homepage. So you can do that from a desktop or from your smartphone if you have one of those. If you're talking about a wearable activity tracking device, that is not necessary for tracking the healthy habits.
Awesome, guys. So I think that's all for questions, and we'll bring it back to Karen to conclude our session.
Sure. Thank you, Sharon, for summarizing and for your great input. It was excellent to have somebody who has firsthand experience on the physician's side. So we hope you all enjoyed this hour here and learned a bit more about becoming an empowered patient. This webinar was recorded, so you'll receive the recording within 24 hours. If you have any follow-up questions, feel free to contact us via the email that was used to set up the webinar. You should have that in your webinar confirmation, and you can always connect with us on social media and on our blog as well. So thank you all for coming today.
Thank you. Bye.
Thank you.